All right. Well, hello and good morning, everyone. Again, I know that you've probably have begun to get lots and lots of mail coming to you from all kinds of different insurance companies and so forth, offering you fantastic deals, trying to entice you to enroll with them. But that's all a lot of just basically a lot of junk. You don't have to worry about that. ACERA's plans are group plans, and so they're well um, benefited. Okay, so you're going to get fantastic coverage through our group plans. And I'm going to be covering that today. And I'm also going to kind of explain about Medicare and things that occurs as you become Medicare eligible. Okay. All right. So again, Mike's already done the introductions. That was Mike Farah. I'm Ish Pena. And we're going to provide you a Medicare overview. We're going to talk about ACERA'S benefits and the Medicare mandate. How Medicare works and Medicare plan options. And of course, we'll have some questions and we'll try to answer as many questions as we can. Okay. So who is eligible for Medicare and who's involved? Well, normally it's people who are 65 or older. If you're under 65 and disabled, or anyone that has ESR or Lou Gehrig's disease, okay, is basically Social Security is we use it SSA. They're the big boss, of course, and the Center of Medicare and Medicaid Services, CMS, falls under them. Okay. So now, if you're currently receiving a Social Security check, then you're going to automatically be enrolled in Medicare A and B if you're eligible. Okay. If you're not receiving a Social Security check right now, because there are some members who want to wait till you're a little bit older, because you get a bigger benefit for Social Security. Then what we encourage is that you're becoming age 65. So we encourage you to give Social Security a call and let them know that, hey, I'm going to be turning 65 and I want to know what I need to do for begin the process to get my Medicare A and B. And then they would go ahead and check their records and verify that, oh yeah, everything's current, fantastic. We're going to go ahead and start the process for you and so forth. Okay. They say it's automatic, but we always encourage everybody just to give them a call, just to make sure that they have a current address and all that other stuff. Okay. Now, Medicare Part B will be deducted from either your Social Security check or you'll be directed to get a direct bill. Now, they bill you quarterly, okay, which means they'll send you a bill for 3 months worth of the premium, and you want to go ahead and pay that premium to them. Okay. Although you'll be paying that premium to them here at ACERA, and I'll talk about the MBRP program that ACERA offers, where we activate an adjustment into your monthly benefit, giving you a Part B premium reimbursement. Okay. So your Medicare card will automatically be mailed to you. And so when you get it, you want to make sure that you take a look at the name and keep it somewhere safe, because in the past it used to have your Social Security number. Now they've changed over to where they actually have an identification number for you in lieu of your Social Security number, which is great because a lot of members were losing, or if it got lost in the mail or whatever, or it got washed. If you had it in your pocket, it got washed. You can't read it anymore. But that's information on there that you want to make sure you maintain, because you don't want someone else getting your full name and your Social Security number. Of course, there's a place for your signature, so you don't want to be a victim of identity theft. Okay. So again, some retirees or dependents who are disabled may be eligible for Medicare earlier than age 65. And that's something that Social Security determines. They have their own criteria for disability, and unlike ACERA's retirement disability, Social Security has their own criteria, and what they do is they'll ask you a series of questions, and if they deem you disabled upon their criteria, then they may grant your Medicare early. Okay. Next slide. Okay. So if you're not receiving a Social Security check right now, that's fine. But you still want to give Social Security a call and just inquire about getting your A and B. That way they can go ahead and get that process for you going. Okay. For those eligible at age 65, we encourage you to begin the following process for enrolling in Medicare at least 90 days prior to your 65th birthday. It's basically a 7-month window. It's the month you turn 65, 3 months before, and of course 3 months after. But you want to get your Medicare right at the time that you're ahead of time. That way, when you turn 65, because that's when it becomes effective. Because effective normally the first of the month when you turn 65. And so, of course, being not 65, non-Medicare plan, there's a good chance you're paying some kind of out-of-pocket, okay? Once you become Medicare eligible and you get into the Medicare transition plan, then you start saving some money because the premiums drop down significantly. And I'm going to show you that in a few slides, okay? So again, the phone number there for Social Security Administration, you want to go ahead and give them a call to obtain any information that you may need, just to check in with them. I'll make sure that they get you your Medicare, okay? ACERA'S Medicare mandate. Okay, so when you and your dependent become Medicare eligible, which is usually at 65, in order to continue enrollment, you have to go ahead and transition, get your Medicare and transition into a Medicare plan. Okay, when I start to show you the premiums, you'll see why. It's going to save you some money, and also your co-pays and things drop down like that. Okay, so again, this mandate applies to retirees who are receiving the monthly medical allowance. And also, dependents, if your dependent becomes Medicare eligible, then of course they have to transition over to a Medicare plan, and it'll save you some money. Okay, so currently the carrier that ACERA offers is Medicare group is KAISER Senior Advantage. Those who do not wish to enroll in KAISER Permanente Senior Advantage plan can contact via benefits to get enrolled into an individual Medicare plan that's nationwide. Okay. ACERA'S Medicare mandates. Okay, so here's an example of how you can save some money. Okay, so let's say you're on the KAISER HMO, and of course you're under 65. Currently, the premium for that is $810.72. As long as your benefit years of service is between 15 to 19 years of service, in this case we're using that as an example, then we're subsidizing $433.99. That means your out of pocket that comes out of your retirement check is $376.73. The same member becomes Medicare eligible at 65, joins the Senior Advantage plan, okay? The premium for that plan this year for 2021 is $382.21. Based on their years of service, 15 to 19 years of service, we're gonna subsidize $382.21, leaving them an out-of-pocket cost of $0, okay? So you can see right there, you're saving $376 in your monthly benefit, okay? That stays in your check that we send to you every month. Okay, so you can see why it's, the sooner you get your Medicare, so that you have it when it's actually becomes effective, the sooner we can try to go ahead and get you to start saving some of that money. Okay, all right, next slide. Okay, so what is Medicare Part A? Well, when you become eligible for and enroll in Medicare, there's several parts. Medicare Part A provides the hospital insurance, okay? It pays for Medicare-approved hospital stays, skilled nursing facilities, rehab, not long-term care, but it does take care of some rehabilitation, hospice care, home health care, blood and hospital care for qualified Medicare providers. Typically, you do not pay for Medicare Part A coverage. If you paid Medicare taxes while you were working in, you met your quotas, and pretty much Part A is free. There are some members who may not have met those quotas or who did not pay in. For example, if you're a safety member your entire working career, so you've never paid in, then chances are they may ask you to for a premium for the Part A. But there are several ways to get around that and qualify for it. And I'll go over that a little bit later today. So, enrolling in Medicare Part A, okay? So, if you or your spouse has paid into Medicare taxes, okay, and then as you see there, if you've worked and paid in 40 plus quarters, it's free, no premium for the Part A. Of course, if you have less than the 40 quarters, then there's a premium. Okay, so basically, if you've never paid in, so you don't have the benefits of getting a free Medicare Part A, then you can talk with them to see whether or not, if you have a spouse who's paid in, to see whether or not you qualify being as a dependent for that spouse, because the spouse may have qualified, and so you can get, maybe a way you can go ahead and get still get the Part A at no cost. Okay, so for 2021, you may pay up to $471 monthly to buy the Part A. Okay, that's if you don't get it for free. So you want to make sure you contact SSA if SSA states that you need to pay for the Part A. In most cases, if you choose to buy Part A, you must also have Part B and pay the monthly premiums for both. Okay, there is a late enrollment penalty, so you want to make sure that you enroll and apply for your Medicare within the 7-month window. Okay, and again, it's the month you turn 65, 3 months before, and of course 3 months after you turn 65. That's your 7-month window. If you apply for it after that, you may get a late enrollment penalty. Okay, and you don't want that because that penalty can start to add up after a little bit. Okay, again, you may have to pay a higher premiums for twice the number of years that you could have had the Medicare but didn't sign up. Okay, so it's like a temporary penalty. Okay. Okay, so what is Medicare Part B? Medicare Part B provides the medical insurance. Okay, so it helps to pay for Medicare approved doctor services, outpatient care, certain preventive care services, diagnostic tests, and a bunch of other services and supplies that Medicare Part A doesn't cover. Okay, so you do pay a premium for the Part B coverage. Okay, so for Medicare eligible individuals, the monthly premium in 2021 is $148.50. That's the base price. Okay, whichever. What they're doing is they look back. So there are some members who pay a higher amount than the 148. What Medicare does is they do a 2-year look back. So right now we're in 2021. So they will look at your 2019 tax returns to see what you've claimed, or should I say what you had it on that tax return, and they'll base it off your income there. Okay, and so they always do a 2-year look back. They're always checking back at the end of the year that you'll review back again, or right after, so forth. Because for the new year for 22, they'll look at 2020 and so forth. So they're always checking it. If for whatever reason you feel that the premium is not justified that they're trying to charge you, you're always welcome to go ahead and contact them and discuss that with them and provide them why that the premium seems higher than what you feel it should be. There are times where members may have either sold some property, or they received an inheritance on a certain year, or just that one particular year they took some money out of an IRA or deferred comp account or something like that. And so for that 1 year, your income looks higher than normal, than it really is. So you can contact them and let them know that it was a one-time item, and see whether or not they would go ahead and adjust down the premium accordingly. Okay, there's nothing wrong with contacting them just to inquire about that. All right. Okay, so enrolling in Medicare Part A and B. If one is already getting Medicare, Social Security benefits, except if you're working, it kind of instate your disease, you will automatically be enrolled and receive your Medicare in the mail. Okay, they automatically mail it out. That's what they say. So you always want to make sure that you have your address current with them. Again, you can apply online at Social Security. You can give them a call. You can visit your local Social Security office, but that's kind of like, if you don't have an appointment, that's kind of like going to the DMV. You better pack a lunch and take a nice book or something, okay? Because it may take a while. From what I understand from members who have made appointments to actually speak to a representative, when they have an appointment, within a few minutes of arriving, they get to talk to somebody and so forth. Now, you may want to make sure you check in with them, because I'm not sure, because of the COVID issue that's going on right now, I'm not sure if they've actually opened up the offices to have one-on-one meetings. So you may want to check in with Social Security to see how that's working. I'm not sure if they've opened up their offices just yet. Okay. Again, you can fill an application for enrollment, submit it in person, carry it to the Social Security office, or mail it to the Social Security office. Okay. Now remember, completing the application and submitting it doesn't mean that you're automatically enrolled. So they have to review your record and make a determination, and then you are able to go ahead and enroll. Okay, so Social Security makes that determination. And here's that 7-month window that I spoke of. So it's really a critical time because again, you don't want any late enrollment penalties and so forth. So again, it's 3 months before you turn 65. Okay, it's effective the first day of the month when you turn 65, your birth month. Okay, and then 3 months after your birth month. Okay, so if your birthday falls on the first of the month, then everything shifts up a month. So for example, if my birthday was June 1st, my Medicare would be effective for June. It would be effective May 1st. That's how Medicare does it. They're watching for that first of the month. So if your birthday does fall on the first of the month, then your Medicare will become effective the first of the previous month. So again, if my birthday was June 1st, Medicare would grant me my Medicare May 1st. Okay, so everything kind of shifts up a little bit. So you want to be aware of that. Okay. Okay, again, Social Security's enrollment period, if you missed for whatever reason, you hadn't thought about it, they didn't send anything out to you and so forth. Okay, their enrollment period is January through March each year. Okay, and during that time, they'll go ahead and make it effective July 1st of that year. Okay, so you can still get in to have it, but you know it's going to be a delayed a little bit, which means if you're on that HMO, you're still paying that out-of-pocket costs until you're able to get to Medicare to get onto the Medicare plan. Okay, again, if you missed it, they do have a lifetime 10% penalty for each 12-month period that you did not enroll into the Part B. Okay, so that's a permanent penalty. Okay, it's a lifetime. Okay, so a way to get around that, okay, is if you're working, what's the exception? If you're working, you may delay your Part B. Okay, I know we have several members who are still working. Okay, and as long as you're on an employer plan, if you're working and you're on your employer's plan, okay, then you can waive getting your Medicare until you come off that employer plan. Okay, and so you just want to make sure you reach out to Social Security and let them know, hey, I'm still working. I'm 65. I'm going to continue working. I'm on an employer plan. I don't need my Medicare right now until I come off the employer plan. Okay, and you start thinking about, if you're on your employer plan, you don't need to be enrolling into the Medicare because you're going to be paying the premiums for the Medicare, yet still be on your employer plan. And because you're on your employer plan, Medicare is going to say, okay, well, we see you had some services, but we're not going to pay any of these claims because you're on your employer plan and they're primary. And typically your employer plans are paying, they pay 100% of anything anyway. So why give free money to Medicare to have Medicare if you're on your employer plan and they're the ones that's going to actually take care of your items and services? Okay, so again, contact Social Security, let them know you're still working and you're not going to need your Medicare until you come off your employer plan. Okay, and then at that time, when you're going to actually decide to stop working and come off the employer plan and retire and so forth, then you want to make sure you reach out to Social Security and say, hey, I'm going to stop working. I'm going to come off my employer plan, the such and such month, I'm going to need my Medicare, and then they can go ahead and get the ball rolling to get you your Medicare granted to you. Okay, and you'll be exempt from having to pay any late enrollment penalties and so forth. All right. Employer plans. Okay, here's where I was talking about the employer plans. So again, you want to delay your Part B enrollment. Okay. You only use the employer plan, okay? Or you can enroll in Part A and B and have both Medicare and your employer plan. There's likely no benefit of that because, like I said, Medicare is going to look at the employer plan as being primary and allow them to go ahead and pay whatever items. They're not going to be paying any claims. And so basically giving away free money to them for they're not even going to cover items, okay? Or you can reject your employer plan and enroll in Medicare and then enroll to a supplemental plan in other ways, which usually isn't ideal. So if you're on an employer plan, it's usually a pretty good plan. Most employers provide a very good enhanced plan. You want to make sure you try to maintain it as long as possible until you decide to stop working and retire. Okay. Okay. So here's an idea. Here's a chart that shows you about the Part B premiums for 2021. Okay. So filing individual return 88,000 or less, okay, or filing joint at 176,000 or less, okay. If slide all the way across, you'll see that it says your monthly premium for your Part B, as in boy, would be $148.50. And that is the amount our Board of Retirement has approved for us to reimburse into your retirement check. So every month we'll be activating it, reactivating an adjustment, and every month you'll be given an additional $148.50 as Medicare reimbursement. Okay, and that's based on that you're in Medicare and that you're paying that premium actually to Social Security or Medicare for your Part B. Okay, so they're taking that out of your pocket over here for out of your Social Security check, or you're paying them directly, but in your retirement check here, we're giving you that $148.50. Okay, so it offsets. Okay. Now, as you can see, if you're filing if you're individual, filing individual, and let's say, for example, the third one down, your income's up 111,000 up to 138,000, or filing joint, and your income's reporting to the IRS that $222,000 to $276,000. Okay, then of course your monthly for your Part B is going to be like that. It's going to be $297. Okay, however, ACERA is only going to still reimburse $148.50 because that's the amount level that the board has approved. Okay, so we'll be granting you the $148.50 into your benefited check, but you would still need to continue to pay that $297 to Medicare. Okay. Medicare Part B reimbursement. Okay, so here's what I was speaking in regards to the plan. Okay,
Hey, Ish.
so yes,
We have a question before you move on to the next thing. The question is, I have a part-time job outside of ACERA. Medicare wages are taken out by my employer. Will my ACERA healthcare stop at my Medicare enrollment period deadline?
no, your benefits will still continue here with ACERA. You just need to if you get your Medicare, if you turn 65 and you get your Medicare, you're going to be providing us proof that you have Medicare. And if you're on our plan, then of course you would need to transition over to a Medicare plan. We'll continue. If you're working part-time somewhere, that's fine. That's totally separate. Okay. There only be an impact if you retired and was on our employer plan, or should I say through, let's say through via benefits. If you enrolled into a plan through via benefits and you went back to work for the county, okay, then while you're working again back for your former employer, the county, we would stop the HRA reimbursement while you're working as a retired annuitant. Okay, and then once you stop working for the county as a retired annuitant and notify us, we can go ahead and reactivate the health reimbursement account. But as long as you're on an ACERA group plan, okay, which basically you would be on the KAISER Senior Advantage, you can go back and work part-time somewhere or wherever the case will work for any other agency other than, any employer other than the Alameda County, and it wouldn't impact your benefits whatsoever.
Sounds good.
So again, this is a non-vested benefit. Another question?
Nope. I was just saying, sounds good.
Okay. Okay. So again, this is a non-vested benefit, which means it's not available for dependents, nor will it be reimbursed dependent costs. Okay, so it's only for the retiree member who worked for the county. Okay, to qualify for this MBRP program, you have to have at least 10 years of ACERA service credit or a service-connected disability. You would have to provide us proof of enrollment in Medicare Part B and remain enrolled in the Medicare Part B. So basically, you complete the MBRP form and then supply us attach a copy of the Medicare card that shows you have the Part B, and send that into ACERA. And then once we see that, we can go ahead and activate the Medicare Part B reimbursement into your monthly benefit. Okay, this is not a retroactive benefit. Okay, so if you have Medicare Part B and there are some who've already had it, and then now they're sending the stuff in. Okay, well, it's not a retroactive benefit. We begin the benefit once we receive all the necessary documentation. So once we receive the form and the card and we have it, we'll go ahead and look at when the effective date of the Medicare is. And so if we received everything like today, which is May 20th, okay, and your Medicare is effective June 1st, we'll go ahead and get you activated for June 1st so that you'll start getting your reimbursement. If you already had your Medicare, let's say you had your Medicare last year and you're just now submitting this in, or we just received your documents this month, we will start it June 1st going forward. We're not going to go back to last year and retro pay you back for that. Okay. Again, this is not a vested benefit, and also is not linked to any of the medical plans. So even if you are not enrolling into an ACERA plan, let's say you have another employer, or you're enrolling into your spouse's plan with their employer, okay, that's fine. You still qualify for this as long as you have at least the 10 years of service or service-connected disability, and you provide us proof that you have the Part B along with the Medicare Part B reimbursement form. Okay, we can activate the 148 onto your retirement check. It's not connected to that you have to be on our medical plan. Okay, let's make sure that that's clear. It's not a requirement. All right.
Okay, and we have another question. If we pay less with Medicare, should we register Medicare first and use it before retirement?
If you pay less for Medicare, I'm not.
Maybe it's
I'm not understand what you.
maybe the question is, if you pay less for Medicare, you would pay less for Medicare than you pay for your employer's plan, maybe? If you want to write in any clarifying details, feel free.
Well, okay. If you're talking about only having Medicare and not having an actual medical plan to go with it, Medicare doesn't cover everything. It mostly covers only about 80%. If you only have Medicare, you're not enrolling into another plan to supplement it, then you're going to have some out-of-pocket costs. It's always good to just go ahead and just get into a medical plan and have the Medicare with it. And there's two types of Medicare plans, and I'm going to be covering those in just a little bit. Maybe that'll help explain about what you're asking.
Okay, sounds good. Thanks.
All right.
Oh, and they say thank you.
Oh, you're welcome. Okay. Let's advance the screen here. All right. Now, the Part D premiums by income. Okay, so the Medicare Advantage plan that ACERA offers is KAISER Senior Advantage. Part D in Medicare is basically the prescription portion of Medicare, and Part D is already built into the KAISER Senior Advantage that ACERA offers. Okay, so you wouldn't have to enroll into Part D directly with Medicare to have it. If you're enrolling into our KAISER Senior Advantage, Part D is already built into it, so you don't have to worry about that. Okay, now here's the thing about the Medicare Part D, that Medicare, a way that Medicare Social Security decides to try to make some additional income, okay, is if your income falls, depending upon where your income is here on this chart, they may go ahead and still charge you. It's not a premium to have the Part B. It's an income related monthly adjustment is what they do. Okay, so basically, if you have 88,000, filing individual 88,000 or less, or joint 176,000 or less, you're not having a cost for it. If you're in one of the higher tax brackets, you look down further down in this chart. Okay, for example, if you look at the third one, above $111,000, one slide across, you'll see it says 3180. Okay, so Medicare will send you an income related adjustment billing, okay, for 3180. Okay, it's an adjusted income item that you need to go ahead and make sure you pay that. It's almost like being punished for making more money. I know it sounds bad, but that's basically what it looks like. It turns out to be. So they're charging you this additional fee. They know that you have Part D because you're on a Senior Advantage plan or you're enrolled into a Medicare plan. Okay, but because of your income that you're reporting, they're going to charge you an additional penalty amount adjustment because of your income based on that. Okay, so, and yes, you do have to pay that premium, because if you do not, Medicare will disenroll you from Medicare for lack of payment of the adjustment that they provided to you. Okay, if they disenroll you from Medicare, basically what happens is it disengages the medical plan, and then you're losing the medical plan. So you don't want to cause any disruption to your medical coverage, especially during this time of this pandemic. Okay. All right, so that's the monthly income related adjustment that they'll charge in addition to, depending on your income.
Okay, we have another question.
Yeah.
Question is, I am contemplating enrolling into United Healthcare plan through Via Benefits. How do I know I am enrolled into Medicare Part D?
Okay, I'm actually going to be coming up to that in the next few slides. I'll be going over something like that. But basically, if you're in United Healthcare, our plan now, and you don't want to go into KAISER Senior Advantage, and you go through Via Benefits to get a Medicare United Healthcare plan, that's fine. You can do that. There's two types of Medicare plans, and I'm going to be covering those in the next couple of slides. There's the Medicare Advantage plans, like our Senior Advantage, where your Medicare is, when you enroll, you're basically saying, this is where I'm going for my medical coverage, and your Medicare is assigned to that carrier. Okay, so your Medicare would be assigned to KAISER, because KAISER will go ahead and take care of whatever services you have. You wouldn't have to deal with any billings or submitting any other items, because all you would just have your KAISER card, and you need services, you go to KAISER. Okay, you go get your meds and labs and so forth. Okay, so KAISER on their side, their business office, they provide you your services, and then they're the ones that go ahead and submit whatever items that they need to Medicare, to be reimbursed accordingly for whatever services they provided to you. So they deal with Medicare and all the claim items. You wouldn't have to do anything like that. Now, for supplement plans or Medigap plans, you may have heard that name. Okay, those plans, you retain the power of your Medicare. Okay, Medicare is nationwide, so you can go anywhere nationwide throughout the United States and see a doctor and get services, as long as that doctor and so forth accepts Medicare. Okay, so for example, let's say you're here in Cali, and something's wrong with your eyes, and you want to see a specialist. Okay, and the specialist in the best in the nation is, their doctor's office is located out in Florida. Okay, then as long as that doctor, that specialist, takes Medicare, okay, you can make an appointment. You can fly out to Florida and see that nationwide specialist for your eyes, and have Medicare get that taken care of. Okay, because Medicare is nationwide. Now, when you're enrolled into a Medigap plan, a supplement plan, remember, Medicare only covers 80%. That Medigap or supplement plan, they pick up the other 20. Okay, and that's how you have the full coverage. Okay, so basically, you use your Medicare. Medicare takes care of what they're going to take care of, and the billing goes over to the other coverage, and they say, okay, they see Medicare took care of this 80%, this other 20% belongs to us. We're going to go ahead and take care of that. So that's how that works. Now, in addition, when you have a Medigap plan or supplement plan, that's just a medical. You would also enroll into a Part D prescription plan. So if you're going through Via Benefits and you're enrolling into a Medigap or supplement plan, they will also enroll you into a prescription drug plan, which is a Part D plan. Okay, that way you can have your medical and you would have your prescription coverage. Okay.
Okay.
All right. And here's the two types.
There's another question.
Sure.
The question is, if I turn 65 on December 27th, 2021, and I plan to retire on March 29th, 2022, when should I apply for Medicare?
Okay, all right, let's take a look at that. Okay, so your birthday is in December, but you're not going to retire until, you said, March. Okay, so basically, if you're sure you're going to retire in March, okay, then you would want to reach out to, you would get in December, prior to December, you just want to reach out and let them know, hey, I know I'm going to turn 65 in December, but I'm still employed on my employer plan. I don't plan to stop working until next year, possibly in March, and let them know that so that they don't, try to send you information or try to. They can make note that you're not going to take the plan right now because you're on the employer plan. Okay, and so you would remain on the employer plan, and I would say at least 60 days before. So if you know for sure you're going to leave in March, you want to make sure you contact, of course, you contact ACERA-MEDICARE, okay? Because you want to get your Medicare so that as you're losing your employer plan coverage, your Medicare can become effective. So, for example, as you know, we're on the county plan, the checks that we get this month is paying for next month's coverage. So the paydays in May for the county, they're doing the deductions that's going to pay for June. Okay, so this month's deductions pays for next month's coverage. So depending upon where you're retiring, you want to try to look at those paydays that you're going to be getting, and you can see where the county. Okay, if I'm retiring in March, my check, depending on where I'm retiring in March, my March checks are paying for April coverage. So chances are I may want to have Medicare begin April coverage maybe like May 1st. Okay, or depending upon the employer that you're on, because some employers for the county, that you retire this month, we're cutting you off at the end of this month. So make sure you check in with our counselors, and they can help you help to identify that for you. So definitely reach out to us. I would say if you're let's go on in March, I believe you can start to schedule your counseling sessions with us like 90 days in advance. So our counselor will be able to help determine, and they'll take a look at who your employer is and help you determine when you want to go ahead and try to get your request for your Medicare. Okay, and because you've already passed 65 and was already eligible, it's a pretty quick process for them to say, you just give them a call, say, hey, I'm going to lose coverage, such and such, I need my Medicare, and they'll go ahead and get you rolling with that. Okay.
Sounds good. They say thanks.
The ball game does change. Not a problem. The ball game does change, and that's one of the shockers that members seem to have. Because as an employee, as long as you're working your hours, your full-time hours, the county pretty much takes care of a vast majority, if not all you got a small out-of-pocket of the coverage premium for the whole family. If you have a family, they pretty much cover. You got a small out-of-pocket. When you retire and go over to ACERA is only subsidizing the premium towards the premium for you, the retiree member. Okay, so whatever the premium costs for a dependent, if you're going to have a dependent on the plan with you when you retire, that full premium gets deducted out of your retirement check, because we only subsidize for you, the retiree member. We don't subsidize like the county does now, where you can have the whole family on there and they still subsidize the vast majority of the premium, and you have a small out of pocket. No, our subsidy that we provide is only for the retiree member. Okay, so just a FYI on that, because that seems to throw some people like, oh, I wasn't aware of that. So, okay. All right. So the types of plans. Okay. So for example, I did mention Medicare Advantage plans. Okay. It's assigned, your Medicare is assigned to the carrier, and you have a specific medical group. Okay. You have a primary MD, and you get primary have a prescription drug plan built in with it as well. So you do have your little copay that you have to pay. And with Medicare Advantage plans, you must reside within the plan's service area. So there are certain zip codes, service areas, and so forth that you have to reside in to still be qualified to be on that plan. With the Medigap or supplement plan, your Medicare is not assigned to the medical carrier. You don't have a primary MD. I mean, you have your MD. Is your MD. You love that MD. You go see that MD, but your Medicare is not assigned. That's not, when you become Medicare, that's not your primary MD, because with Medicare, Medigap, supplement plans, you don't have a primary MD. You may have a primary MD that you enjoy to go to, but that's not assigned for Medicare. You can go see any MD that accepts Medicare nationwide. Okay. No referrals needed to go see a specialist. You can see any specialist nationwide that accepts Medicare. These are medical only, okay? Does not have a prescription drug component. So when you do enroll into a Medigap or supplement plan, you want to make sure that you get a prescription drug. Okay, so if you're going to via benefits, the advisors over there the advisors. Not only are they going to help you enroll into a Medigap plan, and my advice is that when you do, if you're going that route, when you call them, you want to make sure you have all your prescriptions with you, okay? Because they have what they call a prescription profiler. And basically you provide them that information, and then they'll key it in so they can see and compare the various prescription drug plans to see which one covers all your meds at the best price and copays and so forth, and provide that information to you so you can select which one you want to go with. Okay, I see there's a hand up right there from someone. Mike, can you check?
So we're not using the raise hands feature, we're using the Q&A feature. So if you want to go ahead and type your question into the Q&A, unless you want to use the raise hands feature, then we can do it. What do you think? Are you there?
Well, if she can't, is she there?
Okay, I'll just go ahead and do it. So yeah, if you wanna ask your question, go ahead.
That's Valerie.
Yeah.
Valerie, you have a question?
Yes. I'm currently on, I'm retired, and I'm going to reach 65 in August. And I received my card, my A and B card, and it said all you have to do is just send in a copy of it. And like you said, go ahead and fill out the paperwork, and that's taken care of. And what it concerned, so it was like I'm automatically in. But then you said that you're not automatically in. You have to check with Medicare.
Okay. Well, if you're collecting Social Security, they say that they're going to automatically enroll you and send you a card. But I always tell members you may want to reach out to them just to make sure that they got your current information. But if you've already received your Medicare card and this far in advance, then that's pretty good. That means they're catching up, because during this pandemic, where offices and things closed down for a little bit, there was a bit of a snag and delay with stuff. And so some of these took a long time for some of these processes to occur with these agencies. So, but if you've already gotten your Medicare card, then you're good to go. It's a matter of filling out make a copy of it, fill out the MBRP form, and if you're going to KAISER, fill out that KIPS enrollment form and get that into us, and we can go ahead and get you all taken care of. You're good to go.
Thank you.
Okay. You're welcome. You're welcome. All right. So again, with Medigap's supplement plans, there are copays and deductibles. Those may vary depending upon the plan you select. There's various different types of Medigap supplement plans. Okay, so you may want to make sure you take a good look at those and see which one you want to enroll in. A lot of times it's kind of awkward because you're looking at two different plans. And when you look at the comparison, they look pretty much identical, covering the same stuff, but one premium will be high and another one will be kind of low. It's like, well, why is there such a big difference in their premium? If we're looking at the comparison chart, they pretty much cover the same thing. Well, and what that comes down to is basically the market. In some areas throughout the United States, some insurance carriers don't do as much business. Okay, so they try to focus more on the more populated areas, obviously, because there's more people there, right? So some of these other companies, well, in this case, the big guys are looking at the more populated areas. I'm going to look at this other area and offer this plan. And since there isn't really much competition, I can charge whatever I want. So they may charge a higher premium because they know that, well, you don't really have a choice. If you want this type of coverage, this is what you're going to have to pay. Okay, so you want to make sure you take a look at that and do the comparison and make a decision as far as the premium and the coverage plan when you're looking to select the supplement Medigap plan. Okay, and the entire United States is the service area. All right. Next slide. Okay, so just the FYI, medical plans, dental plans, vision plans that ACERA offers, they are non-vested benefits. Okay, it's so funny. I get phone calls from people say, well, hey, you know, I put in 20 years. I'm supposed to be guaranteed 100% coverage for life. No, that's not true. Don't listen to the rumors inside the coffee coffee place. You know, they're non-vested benefits. Okay, so they can be changed or modified or even taken away, you know, at any time once the board votes upon that. But we're not looking at doing anything like that as far as taking away, reducing benefits. We're always looking to enhance benefits. Okay, I've been around here for 31 years, and you know, I'm the manager over the medical stuff here, and I'm always constantly looking to try to find more to be able to provide to members. Okay, how do I enhance this? What else can we do to make things easier, make things better? So I'm always looking to enhance, and the board has been very, very supportive, and so have administration. So I feel that we have a really good benefit plan when it comes to these benefits for everybody. A lot of these agencies, retirement agencies, don't offer medical anymore, and they don't offer dental vision. So ACERA is one of the only, it's probably the only retirement agency that does still continues to offer these types of benefits within ourselves to our members. Okay, a lot of these other agencies have done away with it, and remember, their retirees have to find coverage outside somewhere. Okay, so non-Medicare plans, generally it's under 65. We have the KAISER HMO, we have United Healthcare Signature Value, and then we have that newer plan, which is the United Healthcare Signature Value Advantage. Okay. Now, with KAISER Senior Advantage, you don't want to get benefits. We have, one of the last reports I did, I had close to 2,000 retirees enrolled in plans through VIA benefits nationwide, and they're enrolled in, I would say, over 256 different plans. There's so many plans out there, and it all, you know, pretty much where you're located. So if you did decide to relocate outside of California somewhere, don't worry, VIA benefits can find you a plan where you're going to be residing. Okay. Our KAISER Senior Advantage plan. Okay, very good plan. Okay, so you must be enrolled in Medicare Parts A and B, you know, based on our mandate. And again, the money part, you know, our plan is only in California. Okay, there is KAISER in other states. Years ago, we did have contracts with the various KAISERs in each state that the KAISER resides in. We're talking about Washington, Oregon, you know, Arizona, Hawaii, Georgia. You know, there's all kinds of other states that have KAISER. Okay, we used to have a contract with them. We no longer have a contract with them. We only have a contract now with our California KAISER. Okay, so if you move out of California and you still wanted to have KAISER, if you're going to a state that does have a KAISER, like let's say you're going to Georgia, or Hawaii, or Oregon, or Washington, okay, you could still enroll when you get there, enroll into a Medicare a KAISER plan, an individual KAISER plan with them, and then you would contact VIA benefits and say, hey, you know, I'm an ACERA member, I'm enrolled in KAISER over here, Georgia or Hawaii, whatever the case is, and I'm enrolled in a KAISER Senior Advantage. I need to opt in for my healthcare reimbursement account, and then you'd still be responsible for paying the premium for that individual plan to that plan, but you can contact VIA benefits, and then they can provide you with the reimbursement of your premiums and copays. Okay, and that's for those who move outside of California. Okay. So again, this plan for 2021 by yourself, an individual, is $382.21. If you have a dependent and you both have Medicare, it's basically $382.21 twice, which is $764.42. Okay. If you have Medicare, or your dependent has Medicare, only one of you have Medicare, then it's $1192.93. Okay. And of course, families, you know, it jumps upward like that too. Now, the benefit of the Senior Advantage, you have a $10 copay. Right now, if you're on KAISER, you have a $15 copay. When it comes to Senior Advantage, your copays drop down to $10. Now, depending upon how many medications you're on, you know, that extra $5, saving $5 for each one, that can add up little by little, right? So, and again, if the $10 copay applies to the person who has the Medicare that's on the Senior Advantage. So if you're on KAISER Senior Advantage and your dependent does not have Medicare, and they remain on the KAISER HMO, right? Their copay is still $15, but your copay, because you're on Senior Advantage Medicare, is $10. Okay, just want to make sure I clarify that. I had someone call me that say, hey, well, you know, they tried to charge me $15. I said, well, you're on Senior Advantage. Well, no, my dependent is on Senior Advantage. Okay, well, yeah, you don't have the Medicare, so you're not on the Medicare plan, so you would still be a $15 copay until you become Medicare eligible and transition over to the Senior Advantage plan. Okay, now we do have an agreement contract with KAISER that provides us with a Part B only plan for Senior Advantage. So if you are one of those members who when you go to Medicare and they're trying to charge you that $500 premium for the Part A because they say you don't get it for free, okay, I recommend you go ahead and you can waive the A and just get the Part B, okay? You can go, then you can still come on to our KAISER Senior Advantage plan onto the Part B only plan, and then be on that $382.21 plan, okay, instead of still being on the HMO plan at the $810. Okay, so again, if you're one of those, they're trying to tell you that they want to charge you for the Part A, you can waive the A and just take the B and come on to the Part B only option for Senior Advantage. Now there's something you want to know about that, okay, is if for whatever reason you decide to relocate and you're out of the service area of the KAISER plan, okay, you can't remain on the Part B only plan. You can't remain on the KAISER plan if you're out of the service area, which means you would have to find a Medicare plan through via benefits or through the public exchange or whatever the case may be. Okay, and those plans on the individual side, they do require both A and B. Okay, so if you are in the situation where you're going to waive the A, so you don't have to pay that $500 premium every month, and just get the B only to be on a Senior Advantage plan. If you ever did need to go back and get the A, okay, Medicare, the chances are they're going to charge you a penalty for not enrolling in it when you could have originally. Okay, so you can always talk to them about that. Again, remember the spouse thing where the spouse paid in and qualifies. You may qualify as a spouse, so you can always talk about them about that. Check in and see, okay, well, what if my wife paid in or my spouse paid in, or whatever? What can I qualify for the A that way instead? And so, but they're always looking to see how they can charge an extra premium or penalize somebody if they didn't do something the proper way originally. Okay. Next slide.
Okay, we have a few questions here.
Yes.
The first question is, will the pre-retirement individual session, so this is the ready to retire counseling session prior to retirement, will that session help decide if I need a Medigap plan and make decisions in general, or should I mostly be ready with big decisions like this? Or is that even a big decision?
Well, so you're talking about the pre-retirement seminar webinar that we also provide, right?
No, the not the webinar, the counseling session that they go to with Kevin's team.
Okay, yeah, counselors, they're pretty knowledgeable, so they're going to be asking about, because they have a checklist, and they're going to be asking about the medical plan. Are you going to enroll into ACERA'S medical plan or not? Of course, they already know your age because they're obviously they're provided that information, and they've probably already ran an estimate and so forth, so they know your age. So they will try to talk to you in regards to what your options are if you're close to becoming Medicare eligible. Okay, so and if you are Medicare eligible, of course, they're going to provide you with information regarding the Medicare plans. And yeah, it is a big decision, because some members, like I said, some members they just been KAISER all along and they just roll right into KAISER. Other members have not been in KAISER; they've been with United Healthcare, and so they don't want to go to KAISER. Okay, and that's fine. Then the option if you're becoming Medicare eligible is to go through via benefits to get a Medicare plan. Now, when you go through via benefits on the individual side, those individual plans, you are responsible for paying the premium to that carrier yourself. Okay, and then through that carrier turns around and reports to via benefits, hey, this member has paid us this premium, this is the amount, and then via benefits will look at the health reimbursement account that ACERA'S set up for you over there and pull money out and reimburse you what you paid for your premium. Okay, So that's how that one works. Whereas on our Kaiser plan, everything still is all done internally through your retirement check. So there is no payment for you to send out. There's no claim to submit, nothing like that. We're doing it entirely in-house. Okay. So, but the plans through United Healthcare, if you want United Healthcare, you go through the individual side, it won't necessarily say United Healthcare. Like, for example, there's Secure Horizons, there's Pacific Care, you know, there's a bunch of plans, but when you see plan title, then you see the little print that's underneath it, you'll see it'll say subsidiary or something like that of United Healthcare, because United Healthcare is a big giant conglomerate. Okay. And over the years, they basically bought up all these other insurance companies. So if you remember Pacific Care, we used to have Pacific Care, right? Here at the county, it's no longer called Pacific Care. It's called United Healthcare. Okay. It's the same company. Okay. United Healthcare bought them out. And that's what these large companies have been doing. They've been buying out all these smaller insurance companies, leaving them with their name, right? But they're actually owned by the bigger company. Okay. So you might say, oh, I don't want to go to Pacific Care. I'm going to go to Secure Horizons. No matter which one you go to, you're still giving money to United Healthcare. Okay. So again, through VIA benefits, those are individual plans. So if you wanted to go, if you're used to United Healthcare and you have your set doctors that you want to go to, so forth, make sure you have their names, have all your medications, so that when you do talk to United Healthcare to VIA benefits to get enrolled, you can provide that information so they can help you find a good plan that you continue with those services. Okay.
Okay, so the next question is, I am retired and receiving ACERA and KAISER benefits. I applied just last week for my Medicare card, and my birthday is mid-July. I'm aware I applied late, and there have been processing delays. What do I do if my card does not arrive before the end of June, which is my ACERA-KAISER enrollment deadline?
Okay. Well, don't panic on that. It's quite all right. So what usually Medicare does, they'll usually send you a letter letting you know that, hey, we've processed your application, it's approved, you should be getting your card, and they'll say whatever number of weeks or whatever the case it is. So you still want to go ahead and provide us with the medical form. If you're going to KAISER, you want to go ahead and provide us with the KIPSA Senior Advantage Enrollment Form. Okay. Go ahead and complete the Medicare Part B reimbursement form. And as soon as you get that letter, because they're going to send you a letter that they've approved you for Medicare, and it may take a little bit for your card, go ahead and send us a copy of that letter. Okay. Either way, we're going to take care of that. The team here is going to take care of that Medicare Senior Advantage form. We process it, get it over to our KAISER team. Okay. And KAISER, because we have a team at KAISER that specifically focuses on our employer group, our ACERA group. So they'll go ahead and take care of it. They have a Medicare team, and when they start to process that on their side, they're the ones that have access to the Medicare database. So they'll see that your Medicare is pending, or it's already approved well in advance. Okay. So they'll see that, and they'll process it accordingly, and they'll put you on a report that we get every Monday. I get a report, and it lets us know who has been approved for the Senior Advantage. And once you appear on that report, the team here is able to change that premium from that $810 down to the Senior Advantage $382. Okay, so it's quite all right. It's always good to do it in advance. You don't want to wait to the last moment, but don't worry. I know they're getting better as now with this epidemic. They're starting to open offices more and more. I believe they're starting to staff more in their offices to get this processed. So we understand that there's a delay on some stuff, but just get everything into us accordingly that you can. And don't worry, we'll definitely work with you. Just keep us advised of what you find. Okay.
Okay, and the last question is, and there's a follow-up. They say, thank you. So I actually send a copy of the KAISER group plan election form to ACERA and not directly to KAISER?
Yeah, well, the reason you would send it, if you send it directly to KAISER, what happens is it goes to their main processing hub in San Diego. And that's where thousands of other forms are all going to. Okay, they'll still get processed, and then eventually you'll show up on the report that comes to us that's approved. Whereas if you forward it directly to ACERA, our team, we can place a copy of it in your digital ACERA file, and we forward it securely into a security encryption to our KAISER team that handles our members. And they go ahead and do the approval and so forth, the process, and get this back to us. It'll still happen either way. It's just that we won't see on our record that we ever got the form from you. So if that's the case, then don't be surprised if we reach out to you and say, hey, we're just checking in. Did you complete the form? Are you going to enroll at KAISER? But remember, you bypassed us and went sent it straight to KAISER. So we're not aware that you completed it and sent it in. So we may be checking in and say, hey, did you complete the form? Are you sending it back? So that's the whole reason. Okay, but either way, it's fine. Either way, you're still good to go.
Okay, and then there's one more question. Will I be switched to KAISER Senior Advantage Plan at 65 while still working until retirement?
If you're talking about if you're still working with Alameda County as your employer,
I think so.
The county does not have a Medicare plan, so you would remain on the KAISER plan, which is the HMO plan that the county has, which is why I'm saying if you're becoming Medicare eligible, and you're on the employer plan with the county, you may want to contact Social Security and waive your enrollment for Medicare. Let them know that, hey, I'm still working on my employer plan. I don't want my Medicare right yet because I'm still covered. Because you don't want to pay them premiums for your Medicare, yet you're on the county's employer plan, which is being taken care of by the county. Because remember, if there's any medical services for Medicare, is not going to take care of that. They're going to reject that and say, hey, no, that goes to your primary plan. We're not the primary. Your employer plan is primary. They need to pay the bill. So basically, you're paying Medicare for premiums they're not even going to take care of anything because they're going to point everything over to your employer plan. Okay, so if you're still working, you want to contact Social Security, waive your Medicare until you come off the employer plan. Just let them know I'm still on my employer plan. I don't need my Medicare just yet, but I'll contact you back when I'm going to stop working and lose my employer plan. And they're fine with it. They just need to know which route you're trying to go. That's all. Okay.
Okay, great. They say thank you.
You're welcome.
Okay, that's it.
All right. Next slide. Okay. And here we have via benefits. Okay. So again, plans through the Medicare exchange are not ACERA group plans. These are individual plans and will not appear on your monthly retirement statement that we pay you every month. Okay. So members and dependents are solely responsible to pay any premiums to the carriers that you enroll in through via benefits. And you can set that up with that carrier, have them do the premium deduction automatically out of your checking account, or if you have them charge a card, however you want to set that up with them, that's between you and that carrier. Okay. And then you want to make sure that you have via benefits. You can also set up direct deposit with them so that as you pay the carrier, the carrier reports to via benefits, hey, we received the premium from such and such this month. This was the amount. Then via benefits processes your reimbursement. They can either send you a hard check, or they can set, if you set up direct deposit, they can redeposit your reimbursement right back into your account. Okay. So either way, you want to set that up with via benefits. When you do talk to via benefits, if you're going that route, you want to make sure you talk to them about auto reimbursement. Okay, reoccurring reimbursement. So for example, you have a set premium. This is your premium. This is what you're paying every month to that carrier. Okay, via benefits, you can set up a via benefits kit. This is their set premium. This is what you're paying every month. So then they know, okay, this is going to be an automatic thing. So every month, automatically, they're going to be reimbursing you that specific amount. Now, anything that's out of pocket, for example, let's say this month you went to the pharmacy and you had to pick up some medications. Make sure you hold on to your receipt from your pharmacist. That way you can go ahead and submit a claim form to via benefits for those out-of-pocket items. Okay, that's the big difference between being on our plan in-house and being over at via benefits on the individual side. On our in-house, our KAISER Senior Advantage plan, we're subsidizing everything and taking care of your premium in-house. Okay, if you went to KAISER, you still paid your $10 copay for your your office visit or your medication, and we don't reimburse that. Whereas if you're on the VIA benefits and you're on one of the VIA benefits Medicare individual plans, you get reimbursed for your premiums and anything out of pocket. So if your co-pays for your prescriptions, office pays, as long as you still have a balance on your HRA account, you can still submit that in as a claim and get reimbursed. Okay, so either way, you can go that route, but you can't get both. Okay, all right. So members who are eligible for ACERA'S monthly allowance will be granted again a health reserves account for their medical out-of-pocket items up to the qualified amount. Only the retiree members are eligible to submit the claims to the HRA for out-of-pocket expenses. Your dependents are not going to get reimbursed for their out-of-pocket items. Okay. All right. So again, enrollment through VIA benefits, because they don't have an office. It's all done through via phone interview. Okay. So you want to reach out, give them a call. Before you make that call, you want to make sure you have all your prescriptions and a list of all your doctors. Okay. That way you can, when you talk with them, you let them know those items. That way they can make sure that all your doctors and so forth, they can check all that stuff with the medical plans that are available. Carriers require both parts A and B on the individual side. Most Medicare Advantage plans have a Part D prescription plan built into it. Okay. Medigap supplement plans are medical, so you'll still need to enroll into a Part D prescription drug plan. And the VIA benefits advisors at VIA benefits will make sure that you do that. Okay. So the licensed benefit advisor will go over all the plans in your area. You just got to make sure you let them know where you reside. Okay. So the plans over there are also nationwide. So we got retirees throughout the United States enrolled in plans. Reimbursements available for retirees out-of-pocket expenses only. Okay, so that's medical, prescription drug plan, premiums, prescription copays, deductibles, any medical necessary costs. Okay. Auto pay and direct deposit are available, so that's something you want to work on with your benefits. The reimbursements for the current plan year must be claimed by March 31st of the following year. So like right now, members who were enrolled into a plan through VIA benefits during 2020, okay, if towards the end of the year, there's still a few items that they didn't submit for claim reimbursement, and now, because the money that you get into your health reimbursement account is good for that particular plan year. So from their plan years from January 1st to December 31st, okay? Unlike the ACERA'S plan years, February 1st through January 31st. So the plans to VIA benefits, okay, come December 31st, whatever balance you have in your health reimbursement account gets wiped out. Then January 1st, you start fresh with the new year, new plan year of 2021. So let's say you still had a few items that you got towards the end of December, and you didn't get a chance to submit those claims in, okay? And now those monies have been wiped out because it's past December 31st. Well, you still have till March 31st of 2021 to submit any of those claim items against any balance that you might still have, if you still have a balance from your 2020 benefit, to get reimbursed. Because of COVID, okay, and all the stuff that's been occurring with this pandemic, we did extend the March 31st date out 60 days. So they have until May 31st to submit any items that they may still have for last year. Okay, so normally you have until March 31st the next year for anything that you may have forgotten to submit from the prior year, and it only gets paid if you still had a balance. Most members still have a balance. The vast majority of members never even get close to finishing up their whatever amount of monies that we've placed into their health reimbursement accounts. Okay, there's very few. I could probably count them on my hand how many members actually have wiped out their HRA account, and it's usually because they may have an ailment, a condition or something, and they're on some specialized medications, okay, which can cost quite a bit. And so because of that, their HRA eats up all their costs, eats up all their HRA benefits. But there's very few that are like that. From a vast majority of members still have monies left over towards the end of the year anyway. Okay. Again, and then with VIA benefits, they do have a website. You can register your login, and you're able to track your reimbursement account balances. You're able to track any claims that you submit to them, and you can check the status. Is it pending? Was it approved? Was it denied? All this other stuff. Okay. All right. Again, the VIA benefits prescription profile. But like I mentioned, once members are enrolled in a plan over there with VIA benefits, they're typically happy and they stay with their plan. What they do a lot, and I do encourage this, is around mid-October, I always tell them, I say, okay, you always want to check in with VIA benefits and have them run your prescriptions through the prescription profiler, because the prescription companies, they're always creating new prescriptions, and they're always moving things from one tier to another, which changes the price of it. Okay. And so you always want to check in with them to see, for my prescriptions that I'm on, is there a better coverage for prescription drug plans that I can change over to if need be? And they'll be able to run your prescriptions through their profiler and make that determination. It's okay, well, this plan covers all your prescriptions at this lower copay and at this lower premium. And then, of course, there's a no-brainer. So, okay, boom, okay, switch me over to that then. Okay. Or they may say, well, no, the plan that you have covers all your prescriptions, and it's still a better plan than what else is being offered at this time. And then, okay, I'll stay where I'm at. So that's the one thing that does occur during open enrollment come October, is members are checking in to see about the prescriptions. Because like I said, that's always a changing item. These prescription companies are always creating new items and moving medications from one tier to another, which changes the cost of those medications. So you always want to check in with them around October if you enroll into a plan over there. Okay. Screen. Open enrollment. Woohoo! All right. So again, your annual opportunity to access and decide if you want to make any changes is always during open enrollment, obviously. So you can change your medical, dental, and vision plans. You can add or remove dependents, cancel medical, dental, vision. So retirees with 10 or more years of service must remain enrolled in the dental and vision plans as the coverage is set and subsidized by ACERA. You can delete your dependents, but you can't stop the the dental coverage or vision coverage if you have 10 or more years of service with ACERA. Okay. Those open enrollment occurs every November. So the entire month of November is open enrollment, okay, here at ACERA. And those plans become effective February 1st. Okay. Now, if you're switching over to a VIA benefits, okay, your open enrollment begins October 15th and runs all the way through December 7th. And your your changes become effective January 1st. Okay. So you see how it's a little bit different there, but that's on the individual side. Okay. So one's monthly retirement allowance must be sufficient to cover the cost of the elective healthcare plans. Okay. So as long as your medical coverage, your monthly benefit that we pay you every month is enough to cover, and you decide to add your dependent on, as long as there's enough money there for us to do that deduction, you can do that. You can't add a dependent on to your coverage if your monthly benefit that we're paying you isn't going to be enough to cover it. Okay, we can't. That'll be a negative gross issue, and we can't have that occur. Okay. Okay, so so you can kind of see what the monies look like. Okay, so for those that are under 65, okay, so as you can see, for 2021, for 20 plus years of service, we're providing $578.65. Okay, 15 to 19, $433.99, and 10 to 14.99 years, $289.33. When you become Medicare eligible, okay, then through the HRA account, if you went to VIA benefits, okay, this is the bottom chart here. 20 years of service in 2021, we're putting in $443.28 a month. Okay, if you're at the lower bracket, it's $332.46, or 10 to 14.9 years, $221.64. Okay, so those are the amounts that the monthly amounts that actually goes in. What the annual amount is for those on the Medicare exchange, and that lower chart there, that 443.28, that basically comes out to $5,319.36 for the year. Okay, the next level down, at 332.46, that comes out to $3,089.52 for the year. And the bottom one, the 221.64, that comes out to $26.59.68 for the year. Okay, and we do have some members who, you know, they get into a plan and they decide, well, okay, this is my premium that I have to pay. And of course, some of these insurance carriers will say, okay, well, if you pay it in advance, we'll cut your break on the premium. And so sometimes some members will go ahead and do that to get that break on the premium. And that's fine. You just got to make sure you submit your claim over to Via Benefits to get reimbursed. And they'll go ahead and they know what you're going to get as far as your allocation for your health reimbursement account. And they'll be able to go ahead and get you reimbursed accordingly. Okay. All right. So now I see, looking at the top chart, looking at the bottom chart, I know one of the questions that always comes up is, okay, well, I'm 20 plus years of service. I was getting 578.65, and now I become Medicare eligible, and now I'm only going to get 443.28. Why am I getting reduced like that? Well, the reason is when you're on the when you become Medicare eligible, the plans drop down significantly as far as the premiums. Okay, they drop down significantly. You stop and think about it. Remember earlier I showed you the KAISER Senior Advantage plan was only 382, right? So you can see where the HRA thing is a lot more than, still more than that. Well, remember that's a group plan. That's our group plan, 382 for our KAISER Senior Advantage group plan. Plans that are Medicare eligible to the individual side, to the exchange, are even lower in premium. Okay, I got a member who's over in Georgia, and she's on the KAISER Senior Advantage plan over there in Georgia, and she was paying, last I spoke to her, it was costing her like $39 to have that plan. I know that's a wow thing, right? But it's different, and from state to state, it's amazing how different each state mandates certain things. But so for her, $39 to have that plan, you know, and she's eligible for 443, she doesn't have to worry about any of her co-pays for prescriptions or anything like that, because she has more than enough every month to cover that. There are other members who get into a supplemental plan. Those can range, depending upon which level you decide to choose, can be anywhere from 159 on up to, like, you know, 219. So you can see how there's still money there left over for any co-pays that you may have for prescriptions and so forth. So, and not everybody, it's amazing how not everybody goes to the doctor. I mean, stop and think about it. When was the last time you went to the doctor? A lot of people don't seem to like to go to the doctor. I always encourage, always go to the doctor, even if it's just once a year. Go get checked just to make sure everything's fine, get your labs done. You don't want anything sneaking up on your, or building up. If you're feeling any kind of ailment, a little uneasy about stuff, you know, contact your doctor, have some labs done and so forth, just to make sure that your numbers and your blood counts and so forth are all still within a good, healthy range. You know, we want you to stay healthy and be well. Okay, so definitely there's always money left over for a vast majority of our members who are in a Medicare plan through the exchange. Okay. Okay. Qualifying events. Well, of course, a loss of coverage is a qualifying event. Relocating out of the service area of your plan, that's a qualifying event that would allow you to also enroll or change a plan. And your open enrollment, that's a given. Becoming Medicare eligible is also a qualifying event that allows you to change plans. Retiring after age 65, getting married. You know, you get married, you find love, you get married. Okay, then you got 30 days to add your new spouse on. Okay, a new domestic partner. Okay, you fall in love, you got a new domestic partner. You fill out an affidavit, that's a ACERA affidavit, that this is your domestic partner. And then you can go ahead and submit also the form to add them on as a dependent. Okay, provided that, you know, your monthly benefit is enough to allow for an additional premium coverage for that particular dependent. Okay, so those are qualifying events. So if you experience any of those, definitely contact ACERA and we can we can talk with you and work it all out and help you decide what you want to do. Moving out of the service area, okay? We try not to bother you, okay? Some members, as soon as they retire, we activate direct deposit, and all of a sudden, boom, they vanish off the grid. As long as the money's going into the account, they don't want to be touched, bothered, don't send me nothing. And that's fine. But there are certain times where certain things occur and we need to contact you, okay? So we're always trying to tell you, don't forget to contact us if you're looking at relocating, because there's a good chance you might be relocating out of the service area of your medical plan, okay? Our dental and vision plans, the DPO and the VSP plans, those are nationwide, okay? But the medical plans, remember, they have a service area. So if you are looking at relocating, you want to make sure you contact us so we can double check to make sure, okay, where you're going to go. Okay, yeah, that plan is still good. You can, oh no, that plan is out of the service area. You're going to have to contact such and such to change over to a different plan. Okay, so we want to make sure that you're all taken care of. Okay, so it is very critical that about that as far as that medical. You can reach out to ACERA for assistance in this matter at any time. Okay, even if you're just thinking about it, you're on vacation, you see that beautiful little cottage house. Oh, I love it. I want to buy it. Blah, blah, blah. Just, you know, you can just let us know. We'll help you out. Okay. You can complete an ACERA address change form and send it in so that we can update your record. Only a signed change form will be accepted. No phone calls, no emails. Okay. So you can print out the form, you know, complete it, sign it, and then attach it to an email and send it in. But we still want you to, we still need that signed form. You can also go onto our website if you create your login for our web member services, and you can do that online also, okay? So retirees who reside outside of California may not be required to pay California state taxes. Tax laws change from state to state. So if you do decide to relocate out of California, you want to make sure you contact us to get a California state form, tax form, so you can mark that you don't want the California state taxes taken out of your benefit if you're living in another state, right? You don't need any happy letters from California state, you know, when you're living somewhere else like that. And remember to send ACERA completed address change, name change request form, which can be found on our website. And our website's right there, acera.org. Okay.
We have a question.
Sure.
How about living out of the country? Can I retain a local address so I could be a medical tourist in California?
Well, you got to keep in mind if you are outside of the United States, because if you have Medicare is good throughout the United States and U.S. territorial waters. Okay, if you relocate, like we did have some members who relocated out to. Some members went to Paris. We have some that have gone to back to Australia. You know, some have gone to England, Scotland. So if you do relocate out, you want to make sure that Social Security is going to basically you're out of the service area of the Medicare stuff like so. You can contact Social Security and see about if you stopped the Medicare, can you reinstate it back when you return into the United States? You know, it's a real touchy situation about that. I'm trying to recall whether or not they would, if you collect the Social Security check, they're going to be automatically deducting it, so it stays in there. But if they have an address that's outside the United States, they're going to see that you're out of the area, and chances are they may not pay, claims or so forth like that. So, in regards to maintaining a U.S. address and being out of the area like that, there is a stipulation where it can only be done for up to like 6 months. Beyond that, then you can lose coverage. So you got to be very careful on how you're timing that.
Okay.
All right. So again, you can email questions to us at acerainfo.org. We're always ready to help you. And thanks for viewing this webinar. So yeah, any questions, feel free to let us know. And if you didn't get a packet or if you need a packet, feel free to just contact us and we can get you going. Okay.